Welcome back to my mental health and crime channel. My name is Huda London. I'm a licensed cognitive behavior therapist and a licensed mental health counselor. I would love to start by thanking all my subscribers for all the kind, professional, mindful comments that you leave in the channel, all the good discussions we have. My subscribers are really professional, mindful. We are a small community here, but I believe that we try to keep our boundaries, respect each other, and even when we don't agree on a subject, we agree to disagree in a nice and polite way. So I love my subscribers because they always keep it classic. I don't even have to tell them to do that. They are just the most professional, decent people I have here. So I'm thankful to each and every one of y'all. Today I would like to talk about mental health and how it's affecting us in this world. So many things are going wrong, I personally believe, and y'all can clearly see, due to lack of mental health, lack of, or should we say, lack of knowledge of mental health, not enough resources, not enough support in the mental health branch. And when that is a failure, that automatically affects society and communities in general. Like in physical health, we've always had physical health conditions, and that is more clearer to see with blood tests, with x-rays, with scans, with different kind of tests. It is much easier to spot physical problems and issues. But when it comes to mental health issues, it's not so straightforward as it seems. That is the reason we need to focus more on it. Another thing is that mental health has been a stigma in many societies. Let's be honest. Even in the Western countries, if it was like 10, 20 years ago, and if people needed mental health support, we would automatically consider it as a stigma or believe that that person is crazy or that person is kind of different to the society, or that we should be aware of that person because they can get us into a lot of difficulties. And that is it's because we do not know how to deal with it. But now things have changed in a positive and negative way. Things have changed in a positive way, that mental health is becoming more important subject. So that is good. But it's sad that it had to become an important subject and something important to discuss about because of all the side effects of the mental health. When people are not aware of mental health, a lot of things goes wrong. There's many things and parts of mental health branches that we don't even notice kind of belongs to mental health, like drug addiction, alcohol addiction, that comes under counseling. Then we have domestic violence, PTSD, anxiety, depression. There's over 200 mental illness in the DSM-5 module, and that is the diagnostic way of checking out or finding out what issues a person could be or what challenges people face in their mental health. Mental health seems to be something that is being taken more serious now, because mental health, when people do not get help for mental illnesses and mental health, it just leads to other things like crimes, like unnecessary killings, murders. I'm not saying all of it is linked to mental health, but a lot is linked to mental health. Most of the crimes that we recently see lately are linked to mental health. I'll give you a very good example. I've said that before, and I remember some people disagreeing and saying, oh, you're using that as excuse. The serial killer from Stockton, who, thank God, got caught finally in his act while he was on his way to commit another crime, another killing. Today I was reading a bit of newspapers and articles that was put out about him, because they still haven't. They've just booked him in, and he's been brought in front of the court. But the charges, obviously, he's been charged with killing 6 people, and the 7th person was badly injured. That is the black woman that he shot many times, and she was a very helpful witness in this case. So this comes back to mental health, and I remember that somebody in the chat thought that I was making it as excuse, because they were discussing what could have been his motive. And I just said that I'm sure he suffers of some kind of mental illness, like antisocial personality disorder. And the person said, yeah, but that's no excuse and all. And the others were agreeing to them. What people don't understand is many cases of serial killers are obviously linked to some kind of mental illness. Let's be honest, you don't see a normal, regular Jane Doe or John Doe going around killing people. It could be, obviously you may say that, okay, he was killing people unnecessary because a kill for thrill. Even a kill for thrill, I believe, has some personal mental issues there. Because to take somebody else's life or to take your own life, there has to be some kind of underlying mental issues. So today, when I was reading about the serial killer, his name is Wesley, they mentioned about his mental history. And they said that he had a brother who got shot and killed. I don't know under what circumstances that happened. And that he's had a lot of trauma. He grew up in a troublesome childhood. I believe he's lost a lot of loved ones. And he grew up in a society of crime. He was a criminal. He's had many encounters with law enforcement when he was younger. He was involved even in a sexual assault, trigger warning. So just by looking and reading that it didn't surprise me, honestly. Because in my line of duty as a therapist, you can see, although we need to do health assessments and therapies with the person, and especially a psychiatrist is the one who does a psychiatrist evaluation, but we do a health assessment. And when we do therapy in a couple of weeks or couple of months, we kind of get a clearer picture than anyone else in the mental health branch, in a way. Because the psychiatrist sees the patient or the client, does the evaluation maybe once or twice or maybe once a month, but then usually the person goes to therapy. And I just remembered in that discussion on the channel, it wasn't a discussion, it was just like people were writing their opinions and also the person even was indirectly speaking to me, and because I said that he could be suffering of some kind of mental illness, and I didn't mean to make that as an excuse, but I was saying that as a fact because that can be one of the motives or one of the things that come into play with serial killers and with people who take the pleasure of hurting and killing other people. So the person even mentioned to me and said that I go to a psychiatrist once a month, but I don't go around killing people. And I found that to be very rude, kind of funny, but rude in a way. Because by a person going to a psychiatrist once a month, that doesn't necessarily mean that the psychiatrist can see through you or a therapist can see through you. People can act in therapy and people can act in front of a psychiatrist, even in front of a doctor. You'd be surprised how many people who are antisocial personality disorder, psychopaths, sociopaths can actually do a whole bunch of acting. Especially antisocial personality disorder, because a sociopath can't take it too far. They get caught somewhere along the way. They're more like social criminals. So what I was trying to say is the person's excuse was I go to psychiatrist once a month and I don't do it. But what he or she needs to understand is people are different. Your journey in mental health and the other person's journey in mental health wouldn't be the same. Because your background and the other person's background ain't the same. Your experience in life and their experience in life is not the same. It takes a really evil, hateful, twisted mind person to be a serial killer, in my personal opinion, because that means you have no empathy, you have no sympathy, and you have no remorse or care for human life. And that is really sad. So that example that the person gave wasn't the best example to be using, because just because you go to therapy or you go to a psychologist or psychiatrist or counselor, it doesn't necessarily mean that the psychiatrist that you go to once a month can see everything through you. They can make an evaluation to all the questionnaires you give, and some people are good actors. But going to a counselor or therapist once a week or twice a week or whatsoever, or going to a psychologist and counselor therapist, we deal more with the therapy mental health assessment. So it's more like we see the person more than a psychiatrist, We can't do a psychiatrist evaluation as mental health counselors, and a psychiatrist can't do therapy usually. Everyone is just like a nurse has her duties and her skills, and a doctor has his skills. Although he's much higher than a nurse, he would definitely know a lot about the patient, but maybe the nurse is the one taking care of the patients in the hospital, so she may be the one giving out the medication that is prescribed by the doctor, if that makes sense to you. So when you're dealing with a therapist for many months or many years, it's like you get in, yeah, you have kind of a relationship with the therapist, a professional relationship doing therapy. And when we do therapy, people can act now and then, but if you're going to be with the same therapist for many years, eventually the truth will come out once here and there, especially if it's a professional therapist, practitioner who is following and doing the active listenings properly and watching the changes and of the person, the client. So what I was trying to say, going back to the serial killer, is a very good example. He's had a rough background, just like I predicted. He came from a broken society, a broken home. Hate saying that word, but it is kind of the truth. He lost a lot of loved ones when he was a child. He lost his brother to gun violence. I'm not necessarily saying that's what made him into a serial killer, but I'm sure there had to be some kind of antisocial personality disorder symptoms going around with him that obviously was missed. Somebody missed those symptoms, and he could have been in hiding for so many years and acting like a regular John or Jane Doe, so that society couldn't see the danger, the lack of empathy, the lack of sympathy, no remorse, the narcissistic characters of him. All that was missed, because if he went into a psychiatrist evaluation and later on into therapy, then at least the mental health branch would have had a rough idea if this person was a danger to society or not. So it's very important to remember that everyone has their own journey in their mental health process. There's over 200 mental health disorders and illness in the DSM-5. That is kind of the mental health guide that we go according to as practitioners to do assessment with our clients, which gives us kind of a picture of what we are dealing with, or what work needs to be dealt with more. Example, a person could be suffering of different mental health illnesses, because it's called comorbidity. There's many things that can go together at once, like anxiety and depression. Some people don't believe that, but it is very possible. But then we have to go further in to check where that came from at the start, what caused it. So just say a person who has bipolar is more likely to have depression, but then they can have anxiety too at the same time. So if you follow the DSM module, DSM diagnostic clearly, and we work with the person as a practitioner very effectively, and work with their thoughts their emotions and their behavior and try to make the person, not make the person, you can't make anyone do anything, but try to explain to the person how therapy can, especially CBT, can change you by you taking the right tools and skills from us. If you're taking from the practitioner, then you as a person wouldn't need mental health counseling all the time, because eventually when you start getting a bit better, you could always come back to those CBT worksheets that we do in therapy and get a better guide how to work with yourself when you end up in a situation like that, or if you end up in a mental health illness situation, if that makes sense. So that was about how negative behaviors or negative thoughts, cognitive negative thoughts, how they can give you negative emotions that will lead to negative behavior. So it's like a round circle. You have the thoughts, negative thoughts, you have the cognitive, then you have the emotions, and then you have the behavior. So obviously, if it's like a circle. So if you change your negative thoughts into more positive thoughts, your emotions become more positive, that will lead to better behavior effects, definitely. Today I'd like to talk about something that is quite helpful. It's called the core beliefs. Core beliefs is usually in cognitive behavior therapy. We believe that everyone has their core beliefs. That will say it's more like inside, like a lens that you see through. In your core beliefs, you would definitely, there's good and bad core beliefs. I mean, there's negative and positive. That's the right word. So let's talk about the negative ones. I'll give you some example. It's to start with, the core belief is how you value, how you see yourself, the people around you, and the world. So you're looking through your core beliefs like a lens of how you see yourself, people around you, and the world. So some people end up having negative core beliefs, and those negative core beliefs are put in like 3 different categories. There's one, the first one is the helpless core beliefs. Like when you say, I'm weak, I'm vulnerable, you tell yourself, I'm a victim, you're very needy, you feel trapped, you feel out of control. You feel like you're a failure, you feel like you're not good enough, you feel like you're a loser. Hate to say the words, but that is part of the helpless core beliefs. Then you have the unlovable core beliefs, that you have that belief to yourself that I'm unlikable, I'm undesirable, I'm unwanted. Example, so the negative is I'm unattractive. You think that people view you to be different from other people. You believe you have a defect. You feel like you're not good enough. You feel like, just say, not getting into a relationship because you feel like you're going to be rejected, or the person wouldn't want to have anything to do with you. It's like all those negative thoughts that you're feeding yourself. So you tell yourself, oh, I'm bound to be rejected. Do not do that. Do not approach someone. They may actually not talk to you, or maybe they don't see you as attractive, desirable, wanted person. They're going to look at you as you're different, you're weirdo, you're not good. So it's more like you put yourself in this situation that you think that people are just going to abandon you. You think the worst, you think the negative, the most negative things. And that's the unlovable core beliefs. Then you have the third one, which is the one that leads a lot to depression. All of them lead to depression, but that is the one where people say to themselves, I'm worthless, I'm unacceptable, people won't accept me, people don't like me, people will think I'm bad, people think I'm a waste, people think I'm toxic, people think I'm evil, people think I'm not worth to be around. And even they come as us to think I don't deserve to live. Why am I here? Or they think like, don't make friends because the friends believe basically that you're waste, you're bad, you're evil, you're unwanted. You make yourself believe all these worthless core beliefs. So it's important in cognitive behavior therapy to work with all those negative thoughts that one person is going through. It's really important so that you get out of this negative circle. I always say that to do that, it's not only about changing your negative belief of yourself and working on it. I always say I tell my family usually, like, start by loving yourself, caring for yourself, telling yourself you're worth it. Questioning yourself, why would you think that people would think so negative about you? You get me? Like, you challenge, as therapists, we challenge people's thoughts and ask them things around it. Why would you, like I would have said, why do you believe that you're unlovable? Has somebody told you that you're unlovable? And the person may turn, the client may turn and say, no, but I just feel that. So you have to like dig in more, like kind of in a very cautious way, by asking them, challenging them the questions and asking them, okay, you said you're unattractive. Why do you believe you're unattractive? And then the person may say, I believe the lenses of my, sorry guys, the lenses of my camera is going really weird today. Yeah. But then you just have to try and challenge people's belief by asking them questions around it so that you get a clearer picture and so that they get to understand themselves more. And that is the core belief. So they have to work with the negative core belief and make themselves understand that they're lovable, they're desirable, they're wanted, they're attractive, that they're not a waste person, that they're not toxic, that they're not a failure, that they're good enough, that they're worth it. Like, yeah, people, it's about helping themselves to build their self-esteem and their self-confidence. Others, it just puts them in that negative circle. That is actually kind of, it looks really easy for people, but it's really difficult to get out of it once you're in that circle. So it's important to seek therapy if you're feeling such feelings, or to even, that's what I'll tell all my clients, because that is part of cognitive behavior therapy. Get yourselves a learning journal and just sit and write your thoughts in. Even record your thoughts of days you feel negative and the reason you feel that way, and what is the reason that you make yourself believe that the world views you in a negative way and people view you in a negative way, and what is the reason that you view yourself in a negative way. So we try as cognitive behavior therapists to work around people's negative thoughts. And once they start working on their negative thoughts, their emotions like being depressed, feeling lonely, feeling isolated, feeling down would change. It's all about the thoughts. You start with your thoughts, and once you've improved your thoughts into they have to make themselves understand that they're not worthless, that they're worth being here, that people love them, people care about them. And core beliefs comes with something called automatic thoughts. The automatic thoughts is even when you have the assumption mostly that you have when you have negative automatic thoughts, you have the assumption. Example, like, just say your boss calls you and you're in the other working room and he says, Huda, come over to my office, I need to have a talk with you. And then I automatically think to myself, okay, what does my boss want? Is he going to fire me? If he fires me from the job, how am I going to feed my kids? How am I going to live? How am I going to survive? How am I going to pay my rent? Am I going to be homeless? I'm a failure. I'm not worth it. I'm bad. My boss doesn't want me around because I'm likable. I'm unlovable. I'm undesirable. I'm a failure, basically. I'm worthless. And then I put all that in my thoughts into my head. And then I think the worst, and then it starts putting me into the negative thoughts, negative or automatic thoughts, puts me in a situation where I'm depressed or full of anxiety. My emotions start running wild. My emotions start maybe I start thinking, no, don't come to work tomorrow, just isolate yourself, it's not worth it, he's going to fire you. And then maybe my behavior, that's where it comes to the behavior, that I end up isolating myself, switching on my phone, not talking to anyone, not talking to the people from work. It's because I put myself into the assumption of negative thoughts, negative automatic thoughts. But then just say my boss calls me and I think to myself, oh, actually, this should be fine. Maybe he's going to give me a promotion. Maybe he's going to give me a compliment about the hard work I've been doing. Like, if you change your thoughts, and then just say you go to your boss and you'll be thinking, like I said, if it's negative thoughts, you'll be thinking, I'm going to get fired, and all these things above, I'm a waste, I'm not worth it, I'm a failure. And I go to my boss's office and he says, you know, Huda, I'm really impressed of the work you've been doing recently. I've decided to promote you to becoming an assistant manager. Example. So that's what I'm trying to say is you can change the way you think. Your thoughts can be changed from negative thoughts to positive thoughts by working on yourself, by believing in yourself, by loving yourself, by caring about yourself, make yourself believe that you're lovable, you're desirable, you're not a waste, that people like you, you're worth being a friend, that you are wanted, that you are a good person, which you are. So working with your self-esteem, working with your self-confidence is very important, and that usually ends up in a good result. But if you keep on going in the negative automatic talks and core beliefs, if you have the core belief that everyone around you doesn't like you or doesn't want to have anything to do with you, then you'll end up having to go through serious negative thoughts and emotions and behavior. You'll end up being depressed, you'll end up isolating yourself, you'll end up believing that you're not good enough, and that is just going to put you in deep depression. You may end up having anxiety, being around, socializing around people. So that is something you can actually change very easily by starting to think positive, by starting to make yourself understand that you are worth it and that you should understand, like not only understand, make yourself believe that you're a good person, that you're wanted, that there's nobody here who's out to hurt you or judge you. So it's very important to start thinking positive, because once you start thinking positive, you change your whole circle of the negative circle you're in. And that negative circle, the negative cognitive side, your thoughts, makes you depressed. It'll make you into anxiety. It'll get you into anxiety. It'll get you into believing that you're not worth it when you are actually worth it. So it's always important to change your negative thoughts into positive thoughts. And it is proven, I've said that many times, cognitive behavior therapy is proven to be a scientific based theory. It is very, very positive. And the good thing is there's so much you can take away with cognitive behavior therapy once you've gone to therapy and you know how to do how to do your work, CBT worksheets, you write your thoughts, you record your thoughts, you work on your positive thinking instead of your negative thinking, you will see that things will change immediately. So it's not like every time you would need to come back to a counselor's office or therapist's office and use so much money. Just take it as a takeaway. Take it with you and organize your thoughts. That is the right word. Organize your thoughts to be positive thoughts. I know it's difficult at times as human beings. People obviously automatically jump into assuming things, but it's always best to think about it in the positive way instead of just jumping into conclusion and assuming things and feel, because you'll end up feeling rejected, you'll end up feeling abandoned, you'll end up feeling that you need to be by yourself, that you're worthless, that you're unacceptable. So work with all those feelings, guys. If anyone is suffering of depression, remember your thoughts can change everything. I know it's hard, like just say somebody lost his job or her job and they feel like the world is coming, everything is collapsing around them. It's just to organize your thoughts. Remember, I usually say to myself, I love that quote, even this will pass. So even when you're in a difficult time, it's not there always to remain. It's up to you how quick you want to snap out of it in a way. I hate to say the word, but that's the truth. Like, don't let negative thoughts take over your world, especially in your core beliefs, because that's kind of a lens you see other people, yourself, That's how you judge other people, yourself, the people around you, the world. So try and change your thoughts to positive thoughts. You will notice there's a big difference. Once you start thinking of things in a positive way, you notice things will change. That's especially for people who are in depression and anxiety and all kind of mental health. For people who are in anxiety, there's just small tips that we all know of that is actually very useful. Even in depression, get plenty of sleep or enough sleep, because if you do not sleep well, your day gets ruined. You feel weak, tired, fatigued. You'll feel many things. You won't be in the, your brain cells even work more rapidly, and they work well when you slept well, you've eaten well. It's not only the physical side of a human being, even the mental side. It's important to drink plenty of water. It's important to engage in positive things and not to isolate yourself and make yourself believe that nobody wants me and all those negative thoughts flowing in. Change your thought process. Change your cognitive thought process. Make it positive, and you'll see positive results, like emotions. Positive emotions will come out. You socialize more. You'll have more self-confidence, and it'll end up in a result of positive behavior. So it's a circle. It's a circle that goes around, which is important that. But it all starts with yourself. You need to make yourself believe that you're worth it, that people do actually care about you, that you're not worthless, that you're not evil, that you're not unwanted, you're not undesirable, that you're likable, that you have so much good to offer. Feed your thoughts with positive thoughts and not negative thoughts. That's what CBT is about, and it's really effective in that sense. Another thing I would advise people is, like, make a structure. That's very important in life, and especially in your mental health. Like, if you sleep at a certain time, say you sleep every night at 10 o'clock, make it a routine to get proper sleep, not to pass your bedtime. It helps, like, if some people who always come in therapy and say, I can't seem to be sleeping well and all. Even I these days don't sleep well, but then I'm having back issues and also that is not something I can control. It gets me out of my sleep at times, and then it's difficult for me to go back to sleep. And then I usually go on social media, just watch some channels and just have a laugh or something, and then it spoils my routine. I would be awake a couple of hours more. And then I notice the next day my behavior changes, my mood starts being more negative, my behavior starts not lashing out, but I'll be like, important things I'm supposed to do, I'll be postponing it. So make yourself a structure. Like, if you're going to sleep at 10 o'clock, half an hour, 1 hour before you sleep, put off all the social media, put off your devices, just lay back, do some exercise. It's really, really helpful. Exercise is not only important for our physical state, it's important for our mental state too. The brain needs plenty of sleep, it needs plenty of water. It's just like a flower, in a way, that you nourish with water, with fresh seeds, with enough light. But then if you forget that plant or flower and you forget to feed it or give it water, it's going to dry out. And another thing is when people are working, guys, make sure you don't get burnouts. Don't take an overload that you can't carry. I have a younger brother who's like, he's 31 now. My youngest brother, actually, and he's been promoted as a manager in a very valuable job for the last 9 months, actually. And every time I call him, like he has a child, he has a 3-year-old, and every time I call him, he's overstressed. He'll be sending me text messages saying, "Oh, I've worked like 10 hours today non-stop." And he used to go to training and all before, and now he sees that his whole life pattern has changes. And he'd send me a text and he'd say, "You're the counselor, help me. What should I do?" And I always tell him, I tell him, you don't want to hear the truth, so why are you asking me? Because I've always warned him. I said, you have a good job, you get well paid, you have a respectful job because it's in the council. And I was telling him, but that is not the way. He said he's like, now he's a manager of a certain department, but there's the highest manager who runs the whole department over there, and he's next to the manager, although he's the manager in a smaller department, if you'll understand what I mean. And his boss is so, he finds him so responsible, and he's always been like that. My younger brother, we were more like, we had our times, ups and downs. Our other siblings, my youngest brother's always been straightforward, very hardworking, so, and very responsible. He has a lot of responsibility since he was a kid. Like, nobody put their responsibilities on him, but he decided to put it on himself. He always had boundaries. He had very few friends, very decent friends. So his boss has noticed that good quality from him for many years. He's been working there for 8 years, 9 years now. Since he was 21, 22, and now he's 31. He's been working there for many years. So I've noticed that his boss overloads him sometimes with work. That's what I personally feel. And he tells me, no, that's just a line that I work in, the branch I work in is like very kind of demanding in what we do, and we just have to get it done. And I always tell him, what's the point of you being a manager now when you're burning yourself out? If you have a burnout and it affects you, who's going to look after your daughter and your wife? Like, who's going to look after your health? He hardly takes 3. He'd be like working 6 days a week and sometimes 7 days a week, even on Sundays. So now I've noticed that he's starting to understand that what burnout can do to a person. Because he said now it's like, I'll be working 12, 13 hours and I'll see myself falling asleep on my way home and getting really tired and all. So that's what, it's important that we should know our limits and our boundaries. Sometimes we think we can handle everything, but maybe the brain can't handle all that. It's important to take sufficient vitamins, minerals, eat plenty of healthy food, sleep well, do a lot of exercise. Even I'm a lazy person. I don't like to do exercises. Once a while I do it, but I'll be honest. It's so strange. When I was younger, I was in a boarding school for 10 years, and we used to do from hockey to football to basketball to swimming, name it, every sports. I really mean it. We used to do it all. And I was quite good at sports because we started from a very young age at 6, 7 years old in primary school, right up to year 11. But then the last 10 years is just maybe I myself are a bit burned out in like working too much and all, that I don't make time for exercise. I can do exercise at home. I go end up buying so many training products and like all these devices of these training things and everything. I would use money on them and I would just put them in the store. I couldn't be bothered. So my weight keeps on going up and down. It's like, and like, but it helps me that I do walk a lot at times. But then there would be days that I myself would be a bit depressed and decide just to stay at home and all that. So it's important to have a structure. That's the word I'm searching for. To have boundaries. Boundaries, I mean, like even putting off your devices when you're going to bed, because being too much on social media is toxic, and I'm sure everyone agrees with me. You will feel it. It drains you out literally. You feel kind of happy and accepted and all when you're on YouTube streams and all. But then later on, you notice it when you have to get up early next day and go to work, and you regret it and you'll be thinking, oh my God, what was the point? And there's so much doxing and bullying and attacking people on social media. That's what I try to. I won't. I won't forget. Like 2 years ago, when I was on social media a lot in live streams and all, I used to really have a good time and all. Like being involved in these important cases, the people I chat to, everything. I would say 70% were good, maybe 30% were a bit toxic towards me, but many of them were good towards me. But still, it drained me out. And then I noticed, actually, from I believe the beginning of this year, from March, yeah, around February, March, I decided, no, that's it. I'm not going to go into social media that much. I started reducing, getting into people's channel as guests in their live streams, and then I started deciding just to cut myself out from toxic live streams, arguments, bullying, doxing, because it just hurts me to see that, because not only as a human being does it hurt me to see somebody getting like threats, or somebody is address being put up there, or their personal information, all the trolling and doxing and everything that's going on. It started making me step back a bit and think this is actually giving me a burnout more than my own job. And at least my job is paying me. But what am I doing here when usually, even in the live streams, many YouTube creators are doing well and trying to spread the awareness, but there's so much nonsense and toxic going on that you start asking yourself, what is the aim? Why am I in these live streams? Is it to save Summer Moon? Is it to save Orin and Awesome West, Michael Monkey Wong, Harmony, all those children that need justice? Then I decided to myself, why don't you just get out of this? And if you're going to do anything, do it in your own respectful time, in a respectful way. And that is the reason I thought to myself in January, it was, yeah, end of February, March, I thought to myself, just start your own little YouTube channel so that at least you can spread mental health awareness. And at the same time, so that you can follow these cases that are important and not just dwell on a case. Like example, the Kylie Rodney case, everyone in my channel knows that I really care about Kylie's case and I want justice for Kylie. But then at times I do accept, if this is what her family wants, if this is what place in Nevada County came out with the results, then we need to take a step back. Who are we? Like the mother says, we need to mind our own business. But then just by going and continuing and continuing, and you see all these live streams, these big YouTube creators reading autopsies and all that, I feel like laughing. I'm sorry to say. Because we ain't the forensic team. We ain't the autopsy people. We ain't the doctors who are working with it. So even if I did try and read Kylie's report and the autopsy, but I won't lie to you, I understood a lot of it. A lot of it did not make sense to me. But then still, even no matter how much we read it, most of these YouTube creators need to understand you have to have the skills. You have to be not only a doctor, you have to be a special skilled doctor in that department of dealing in the coroner's office, dealing with people who have died drowning or have been set on fire, God forbid, such things. Many things intend to intend to be difficult for the doctors to get exactly the answer that we all are searching for. But imagine all the YouTube creators. I love and respect them, but if you're using so much time for Kylie, why couldn't we use that time for other missing children who really need our attention? And in a positive way, not like in Quentin Simon's case. We all want the mother to be arrested, but if we just go in front of the mother's yard just recording and checking into motels and all, what is the point? What are we trying to prove? Freedom of speech is there, but to a certain limit. Why waste so much money by going there? Is it to get subscribers and viewers? You could do it by just sitting at home and doing your research. You'll find out doing your research more at home than going and standing in front of the person's house and just being a nuisance. That is my personal opinion. Many people may agree with me or disagree with me. But I like to be always genuine and honest and say it there. Because there's so many other ways to get at awareness. I've been telling people for a very long time. Look at the fentanyl epidemic that's happening. And it's Halloween time now. Many children could get sweets and candies that are laced with such toxic things that can kill a whole community within a second. So those are the things we need to be spreading awareness about. A serial killer around, yes, spread that awareness because it's something that affects the whole community. I can imagine how the community of Stockton, California with the serial killer, I can imagine the anxiety, depression, the trauma that they have been living with for the last couple of months, because it's like you imagine having a serial killer running loose. You'll always be thinking, am I next? You'll always have to have two eyes behind your head, which you can't. And then there will be so many copycats after that. So such awareness is a more important, to spread than to just be on social media reading autopsies that we don't even know anything about. And it's not just being a doctor and reading out autopsies, like some people are doing it in YouTube. This is doctors that are experienced with dead bodies and been working in the coroner's office for a very long time, and they know how to deal with such things. I personally believe, yes, there could have been a lot of things that are missed out in Kylie's case. I won't lie, I've never said that everything is right there. You can see clearly a lot of red flags, but then when I look at it, that's how I've moved on in a way. Because the more time I spend on this, on Kylie Rodney's case, it's not going to change anything. And I like the fact that how people are sitting in YouTube and discussing, oh, that this is not the end of the autopsy, there's more to come. There's nothing more to come. Placer County has wrapped it up. They said, like it or not, this is the decision. It was accident, it was accident. Period. For them, according to them. So I will follow them because they're the ones. It's their community, the people in Truckee and Placer County and Nevada and Sammy and Kate and all of them. They can all go and decide whatever they've decided in their communities. Just sad that that's the way it works. But right now, there are other missing children, the other cases that need justice. There's other awarenesses to spread like mental health, fentanyl. That is even part of mental health. Overdoses, such things, drug addiction, alcohol addiction. There's so much, guys. So let's give those cases to some attention. They need it. In December, it'll be 2 years. It'll be a year, yeah, that Lena Sadar Keel has been missing from San Antonio, Texas, the 3-year-old girl from Afghanistan. Nobody pays attention to that case. And sometimes I just sit and I wonder, this is there's no equality here. I'm sorry to say that. It's like we pick and choose the cases we want, not being mindful that all children are equal and all children are loved and all the missing children need attention. So I don't know what to say, guys. But I intend to move on to other cases that need awareness, and not only need awareness, that we need to learn something from. Like the best one was yesterday. I personally believe, I hope you all got a lot out of the clip that I made yesterday about Gabriela Venera Petito and Brian Laundrie, because that was about domestic violence, and such things are definitely mental health, and such things are very frequent. Many women in this world, thousands and thousands of women, lose their life to domestic violence, and some men too. It's not always women only that are victims, it can be men too. So things like that, domestic violence, I intend to talk about, and I think we should all talk and focus more on that topic. We need to focus more on mental health. We need to focus more on in YouTube, or being a YouTube community where we love, support each other, and don't put each other down unless the other YouTuber is going offside in something, without being angry or hateful. We can say it in a mindful way. That's what I believe. Because I have been pointing certain names, and yes, I will never back off when I point those names. I will still point out those names because they still haven't moved off of Kylie Rodney's case. And I think that is part of the mental health that is called boundaries. We need to check our boundaries. Her mother asked us nicely. Her mother told us. Her mother may have said it in a rude way, but I don't blame her. Because she keeps on telling us, mind your own businesses, but we ain't. And by every day, these big creators like Zavgirl putting up Kylie's autopsy, Kylie's pictures, the young youths that were in the party's pictures, that is not putting respect on a dead person's name. that is not putting respect on the family of the grieving person's name. We need to let it go. We need to let the girl rest in peace. The family decides what they want to do. If the family finds it out to be an accident, then so be it. It's about acceptance. That's part of counseling too. Mindfulness, boundaries, acceptance, of keeping your self-value or self-dignity. We're not supposed to be destroying these people's cases. We're supposed to be honoring these people's cases. Anyway, guys, remember to work on negative core beliefs. Remember, you're not helpless, you're not unlovable, you're not worthless, you're not bad, you're not a waste, you're not toxic, you're not a failure. Remind yourself the positive things, that you're lovable, that you're not a victim, that you're not needy, that you're not trapped, that you're good enough, that you deserve better. So change your negative thoughts to positive thoughts. And those positive thoughts will definitely become positive emotions. And that will lead to positive behavior. There you go. If you stay away from negative core beliefs and negative automatic thoughts, if you work on those, you'll be going into a very happy journey. I promise you that. And that will keep you less depressed. Even if you don't feel like going out, think to yourself always, what is the beneficial thing for me? I don't feel like going out. I don't feel like going for a walk. I feel like staying at home 24 hours. But then think to yourself, okay, let me walk a bit distance today and let me see if it changes my mood. Do it once, do it twice, and you will see a difference. So sometimes we have to do things not because we like it, but because we have to do it for our health, for our physical health, for our mental health, for our positive thoughts, for having a healthy mind, healthy thoughts. Guys, look after your loved ones, check on your loved ones. Mental health seems to be affecting everyone, and certain people more than others. That's why it's important to seek help for mental health, whether it's suicidal thoughts, whether it's domestic violence, whether it's SO offenses, whatever it is. Even this will pass. But remember, there are people out there who can actually help you. And if you'll ever need my help in therapy, or if you'll need advice in guidance with certain things like depression, anxiety, or even other mental illness, just let me know. I can guide you all to some techniques that you can do that can get you out of the negative thoughts as a licensed cognitive behavior therapist and as a licensed mental health counselor. Family, I love you all. Take care. Stay blessed. Sleep well. Look after each other. Love everyone. Love your close neighbors, yourselves, so that we can be a healthy community, healthy nations, and a healthy world. And remember, stay away from the negative thoughts. Change your negative thoughts into positive thoughts. You will see it lead to positive emotions and positive behavior. And that's exactly the results you will be searching for to stay away from depression and to stay away from anxiety. Guys, I'm getting tired. I've been just for these last couple of weeks, you can see it even in my eyes. My back has been draining me out a lot, and I do have a back condition, so I just need to get a good night's sleep. I got up too early today because I can't sleep much. My back stays aching and aching. And see, that's another thing. That's what I'm working with myself about, changing, staying away from negative or automatic thoughts. Because it's always like, even people in my family ask me, with the back condition you've been having, and you're supposed to, like, if it was somebody else, they would have broke down with the pain and all. How do you manage? And I always tell them, I stay away from negative thoughts. I always think there's a better day tomorrow, like waiting. Inshallah, in Islam, that means by God's will. So if tomorrow comes, there will definitely, tomorrow won't be like today. Every day is not the same day. Some days are good, and some days you feel a bit vulnerable, a bit weak. But I'm trying to stay away from negative thoughts, because if I sit and I think to myself, oh, my back is finished, that's it, whatever, what is going to happen, maybe something bad will happen, and then I start getting paranoid, and I start getting like depression feelings that will lead me into depression. So I try and I work on it, just like most of us do. And even as a therapist, I don't even have all the answers, but I learn through my clients, and I learn through myself. And I love cognitive behavior therapy. That's the reason I became a cognitive behavior therapist, and I became a licensed mental health counselor. I do love everything in mental health as a counselor. I love helping couples counseling. I love helping child psychology, anything to do with children. There's many different, counseling is counseling in general, but then everyone takes a certain expertise that they become in. And my favorite one is cognitive behavior therapy, because it's scientifically proven and it's really helpful. I don't mean it because I'm a cognitive behavior therapist, but guys, it's really, really helpful. Because once you start it, and once you start learning more about it, and you adapt on the techniques, and you work on yourself, and you basically, when you maintain, like when you get a structure, not only with your daily living and daily life, but when you have things organized in your brain, they're like, I know there's some things that you can't control, some thoughts in your brain, but then avoid them, work on them. Feed yourself with positive thoughts, not with negative thoughts. You'll see in the long run it will help you. And once you got that right, you'll be surprised how many obstacles you can cross just with continuing keeping your CBT techniques. So please stay blessed. Love you all. Please like, share, and subscribe. Bye.